friends. Okay, perfect. Next slide, please. So again, the National Association was founded in April 2019. This organization was founded by CHWs, Promotores de Salud, community health representatives on tribal nations, and allies from many sectors across the United States. You see our values before you. We believe in self-determination for our very diverse workforce. We are diverse across ethnicity, geography, sector, and experience. We believe in integrity and social justice and the dignity of every human being. Next slide, please. Since the start of this COVID-19 pandemic, NACHW has been at the forefront of really amplifying the roles, the leadership, and the capacity of community health workers and our community-based organizations. I won't spend too much time here, but there is a listing here of some of the activities that we have been involved with. Maria, I see you. Welcome to the webinar. We helped to co-found 2 organizations during the pandemic, the Community-Based Workforce Alliance and the Vaccine Equity Cooperative. And I'll just say that we continue to believe that while we have had a medical response and a public health response to the pandemic, national coordination around the expertise of community health workers and our community-based organizations. So we are so grateful to be partnering with you today. Next slide. Yes, I see you, Priscilla, from Dorchester. I've got family there. So the COVID-19 pandemic shows no sign of slowing down. As a matter of fact, we are entering year 3. And I think we all know in these years, as we have experienced incredible burden of infection, hospitalization. I know many of us have mourned the death of neighbors, faith community members, co-workers, family members, and colleagues. We understand that our community-based organizations and community health workers, CHWs, need more than ever to have all of the tools at their disposal. We have not reached a significant number of people who are vaccinated. There are many who do not understand how to administer rapid tests at home. There remain numerous burdens for our communities that experience persistent and historic vulnerability and racial inequity. And so we're here to partner with you today to bring some of those tools and resources. Next slide. So as a result, as I mentioned, NACHW has been supporting the Biden-Harris administration's rapid test distribution initiative. We're going to talk to you today about what we've been able to accomplish in just the last couple of weeks, where we are today, that the government site is now open, and our website has been receiving requests and partnership over the last 4 hours. So we're going to share with you all of those tools and resources. As you all understand, 500 million individual rapid at-home antigen tests are being made available through covidtests.gov, through this website. This is a limited initiative. And so we're going to talk to you about, again, what this is and what this is not. We hope that the tools and resources we have provided are going to make it easy for you to make sure that you yourself are able to access your free 4 individual tests. We'll talk more about that ordering process later, and that you are also able to help the communities, the families, the individuals where you are living and serving. Next slide. So why should you act now? Well, our website has been live for the last 48 hours, And officially today, the federal website, covidtest.gov, just launched. And I'm sure many of you have visited that site or you've seen a social media post. I believe that there have been some interviews and even a press conference by the White House already today. I know Jen Psaki was making comments about that. So we want to make sure that folks are in line. We understand that these kits are going to be mailed and it's going to take time to get this to you. So we want to make sure that you have the information to act today to prepare yourself and your community. Next slide. Okay, so number one, we want to thank you for partnering with us. You're attending an orientation session right now. And with that orientation session, we're going to have lots of additional tools and resources for you. Number two, we're inviting people to sign up with NACHW. This is not a paid membership. We are not asking for you to pay for membership or anything like that. We want to partner with you so that as we learn more about this initiative, as we come up with more information to help you, help families and community members to gain access to these tests, we want to give you updates if the White House initiative changes in any way. And we do hope that it's going to be extended, but we have no confirmation of that now. We want to invite you to join us in strategy sessions like these that we've been doing every day so that we can begin to advocate for even more resource. So this is what it means to partner with NACHW. Next slide. Okay, the most important part of this initiative right now is about ordering kits. So let's quickly go over the important information that you need to know. So beginning January 17th, we started taking orders through the NACHW website. Today, January 19th, every person can go to covidtests.gov, covidtest.gov, and begin accessing the website where you can order your test kit. One package of 4 rapid at-home COVID-19 tests can be ordered per household. So if you have a household with 6 or 7 family members, you will only be able to place one order for one household address. And within that one order, there will be 4 COVID-19 rapid tests. In addition to placing an order for yourself, you can place an order for your household. You can also assist other community members, other families in placing an order for their household. If you want to track the order once you enter it into the website, you are able to enter an optional email address. So you don't have to use an email address, but if you would like to track this package, you can enter an email address and an email will be sent to you. Yes, Rosalba, what happens to families with more than 4 family members? As I mentioned, this first initiative that we are sharing is very limited as it has been described by the White House. So you are only able to place one order for one package, and in that one package will be 4 rapid tests. Yasika, that's right. An email is not required unless you want to track your package. And yes, Ella, we will be displaying the site in just a moment. Next slide, please.
What is someone unhoused?
I'm glad you found the process easy, Hope. Okay, so the last is that, as we mentioned, the work is not done. Setting up this opportunity and making sure that people gain access to their tests is very important. But we want you to think about who else you can help us to reach. So we would like you to share this opportunity with others in your community. You can go to our website, nachw.org/COVID tests, and there's a share button where you can share the opportunity. You can also just share the website link if you want to go directly to the federal government website. We are also distributing an assessment form because, as I mentioned, we believe that community knows best how to distribute these resources, K95 masks, COVID rapid antigen tests, and other resources. And so we're gathering information from individuals and organizations so that we can help advocate and share the way that you would like to help your community and have resources delivered. Many people have asked for bulk orders of K95 masks or COVID tests. If that's you and you're one of those people who would like your organization to be involved in an initiative like that, where you receive bulk orders, we would like to know that so that we can gather that information and so that we can advocate on your behalf. And so if you have time, please do fill out that assessment form. Okay, next slide. So I think we're all set here. This is just a list of the activities that we've been doing all week to get us here. So next slide. Okay, here's what's important for you to know, just in case you are in the middle of your workday and you need to drop off. Here are the set of tools and resources that we have developed to help you enroll and order a kit for yourself, to help you become a partner with NACHW, and for you to reach out to others and help others. We have our webpage that is available right now. Aurora will put it into the chat. Some of you have already visited that page. We have email messaging. So if you want to share this with others in an email, then we can go ahead and share that with you so that you don't have to develop all of the information on your own. We have an extensive list of frequently asked questions on our webpage, available in English and Spanish. All of the questions that you would imagine about how you place your order, how long will the order take to get to your household? Does it cost anything? What do I do if I administer a home test and I test positive? So we have a few dozen frequently asked questions on our website. So please visit that site. We also want to share this slide deck with you. So if you need to share this information with others, you can go to our website, nachw.org/COVID tests, and you will see under orientation our slide deck, and you can download all of this information. Again, we hope that you'll fill out the feedback form so that we can begin to advocate for more resources. And just before we open it up to the website, the last thing that I really want to share with you is the Telehealth Community Navigation Call Center. And we know that some people who are living in rural communities, who may be in a monolingual Spanish community, who may have difficulty accessing the internet, or others may need some assistance from a call center. We understand that the federal website plans to have a call center, but we are partnering with Dia de la Mujer Latina, and they have developed a telehealth community navigation center to help you help others. You see the information on your slide. We want to thank Dia de la Mujer Latina and their leader, Venus Ginnes. They have a bilingual and community-centered call center. It will help debunk misinformation and mistrust, and it will help navigate underrepresented communities into health services. If you need help ordering a test kit, You can also call the English line or the Spanish line, and someone will be there to assist you. So I want to make sure that we thank Dia de la Mujer Latina for their excellent support and their excellent service. Okay, fantastic. So I know that everyone would like to go to the website. Why don't we pull this down? You're welcome, Luz. I see all the thank yous and the well wishes, and I just want to thank each and every one of you. We cannot do it without you. So again, thank you so much for taking your time out. So some of you have been to our website already. And yes, covidtest.gov is also live. We want to show you our outreach materials, our one-pager. We want to share with you how to place your order. Mahalo, yes, nice to see you as well. And then we want to share 3 other opportunities beyond this testing initiative that we think your community may be able to benefit from. So if this is good to you, if you're learning, just let us know in the chat. We want to make sure that this is relevant and helpful. Okay, Aurora, do you want to share the website?
Absolutely. So one of the first places you can visit if you want additional information is our website, nachw.org/COVID tests. Right now, we are linking directly to the White House site. I know there were some requests to go and see what the White House site looks like. Here it is covidtests.gov. And here you can place the button at order free at-home tests. And it's going to bring you right to USPS, who is the one shipping these tests. You will then, either for yourself or if you're helping others, place their name and the optional email here if you want to track it. And then they have the places for your shipping address, and they have additional information. And then over here, once you have done that, you will click check out now. So that is how you order these tests from the White House. Now we're going to go back and look a little bit more at the other resources we have on our website. I know some folks were asking if they were going to be able to access these slides, and these slides are already on our website available to download. They are available in here, and they're also available in Spanish on our Spanish page. We have 2 different one-pagers. Here is one, which is, and these cover some of the other opportunities Denise was mentioning around testing. The first opportunity is the one we have been talking to you about, is that ordering 1 free package of COVID-19 test kits to your home, and that is the covidtest.gov initiative. You can also, if you or yourself or someone else has Medicaid, CHIP, or private health insurance, receive a certain number of free tests per month. And you can read the statements and more frequently asked questions on this flyer. You can also look for a community-based free testing site. On this website, you can type in your location and find the nearest community-based test. I know many folks in the chat were lifting up some of the issues with this residential-based program, that it won't reach folks who are experiencing homelessness and so on and so forth. And this is one of the ways that those folks can still receive free testing. We also want to share a newer opportunity, which is to enroll your facility, if it qualifies, into Operation Expanded Testing. This is also called OpEd, which provides no-cost testing to childcare centers and various other organizations, such as historically black colleges, under-resourced communities, homeless shelters, and so on and so forth. So if your organization qualifies as one of those, feel free to please check that link. Also in this flyer, we have a brief script if you're going to call, and we also link to Dia de la Mujer's number once again. The second one-pager I'm just going to briefly show you is just if you want to give someone an overview of this program, of this ordering 1 package of tests to a residential address. This just gives you the basics of the where to go and how many you're going to receive and so on and so forth. And it also lists some of our partners. And the last thing I'm going to show you, I know lots of folks have questions, so I'm just going to briefly scroll down and show you that on our website, we also have various FAQs. Some of these you can also find on the White House site around shipping and so on and so forth. We also have some resources. I know some folks were asking about what is a rapid test, how to use a rapid test, and we have some resources from the CDC, some images and videos in English and Spanish. So if folks find that useful, feel free to please keep using our site, and we will continue to upload different resources as folks make those recommendations.
Thank you so much. I know that was quick, and I was just in the chat. There's so many excellent questions. I just want to give out a shout out to my good friend, Angela Harris. I was encouraged to see you write that the seniors there at Phillips were having no problem ordering their tests. That's sort of the best news that I could have heard all day. Some of you have asked questions. If you've been to our website, you know that for the past 48 hours, there has been a screening tool asking you for your zip code. And so some of you were asking, hey, I tried it and my zip code was sort of not included and it kicked back this error message. That was for the last 48 hours. And that was part of the way that the White House was testing their system. This is no longer the case. If you go to covidtest.gov, or if you go to our website now, just as Aurora showed you, you click on order and you go right to the site. There is no more screening or filter by zip code. So I hope that's clear. Let's get to a couple of questions. Emily, I know your hand's been up for a long time. Then we'll go to Diane and then Diana.
Thank you very much. Just, I think 2 questions at this time. My first question was, what is the time frame from order to delivery? And I popped over to the frequently answers and questions section on the webpage, and it mentions that they ship right after being ordered. But is there a true time frame? Are you looking like at a week or so for maybe those people who have had close contacts who need to get it done in a timely fashion?
Yeah, thank you very much. So let me say the first thing. If you have a friend, a family member, a neighbor, a client, and they call you and say, I was exposed at work, I exposed me and I need to get a test. This is not that initiative. I want to be very frank with you. These tests are going to be ordered through the US Postal Service, okay? When you place your order, you get a confirmation. And you'll see that in the slides because we sort of share some screenshots, and it will say, thank you for placing your order. Orders will be shipped by the end of January. So I want to be very realistic, again, about what this is and what this is not. What's important is that every family, every household that wants to receive 4 free COVID-19 rapid tests should be able to order them. But this is not for someone who needs to screen themselves immediately. Emily, have I answered your question?
Yes, ma'am. And since they are not for that use, do they have an expiration date that you're aware of?
So good question. So one of the things we've been asking the White House is, what are the companies that they're going to be using so that we can understand which tests are going to be distributed. We have not been given that information. So as we receive it, and this is one of the reasons that we invite you to sign up as a partner with us. Again, there's no cost to doing that. What it does is it just confirms your email and that you want to receive emails from us. But once we receive that information, then we are able to send that out to you. At present, we don't know the companies that are being used, and so we don't have detail about those tests.
Okay. 2 last
Diana?
questions and I'll be done real fast. One, you mentioned, do you know if the expiration date is even on, maybe just on the package? And but the last question, I promise, you mentioned K95 masks.
Yes.
To be ordered. Where is that at? Because I didn't see it on the webpage.
Yes. Okay. So the first question, again, we have not seen any examples of the test kits that the United States Postal Service is going to be shipping to people in this White House initiative. So I can't tell you I have purchased kits before and the expiration is on the package, but we cannot confirm that because we haven't been given that information. The other piece that I shared, which was for each of you, if you're interested, to help us get a sense of your capacity as an organization to distribute bulk orders of K95 masks or bulk orders of rapid test kits. And the reason this is important is because I bet all of you would have preferred that we got on this call and said, we're going to mail to each of you 10,000 KN95 masks and 10,000 rapid test kits. We prefer that because we know that you have your strategy on how to reach those who need these resources. But this is not that initiative. So we believe we have to advocate, right? We have to make the case as community members to say we know best how to distribute this information, how to distribute these tools and resources. And so if you fill out that assessment, that's exactly what we will do on your behalf. Diana?
Yes, actually, that was my question too about the KN95 masks. I did fill out the assessment and I put in the quantity that I think I can distribute as a community health worker, but I just wanted to verify, and I think you just answered my question. It's not guaranteed that that's going to be mailed out, but it's more so to gauge and then bring that forward as a proposal, and hopefully we will have those on hand so we can distribute to underserved community members. Is that correct?
That's exactly right. So one of the things that that we'll plan to do, Diana, is to pull together the assessment. I see some people are asking for it, so we'll throw it in the chat again so that we can create a sign-on letter and say that we have connected with, we have 370 people on this call today. Yesterday was 260, the day before 60, the day before 50, the day before 240. So we're reaching thousands of individuals and organizations. And we want to come together to say we represent diverse communities across ethnicity, geography, sector, faith, and experience. We know best how to reach our communities. And so we would like these resources brought directly to us. I hope that answers your question. Lynn, and then Morley.
Hi. For the people who have Medicaid, do they need a doctor's prescription in order to get the kits, or
Yes.
they just get from the pharmacy? I mean, how does it work for people who have
Yes.
Medicaid?
Very good question. Okay, so just to clarify, because we went through this quickly. So far, we have been talking about one initiative, and that is to go to our website or to go to covidtest.gov and to place an order per household, right? One household address receiving 4 rapid antigen test kits for COVID-19. There are 3 other initiatives that are available to you and that may be appropriate for your community or organization. Here's the first one that Lynn was just asking about. A little more than 2 weeks ago, there was an announcement that individuals who are enrolled in Medicaid, CHIP, that's the Children's Health Insurance Program, or have private insurance, okay? And private health insurance can be something you purchase from healthcare.gov, or you're working with an insurance company, you get it from your employer, you have an insurance card. If you are in that category, we have on our website and in the flyer that Aurora shared, information on how every individual covered under that insurance can gain access to up to 8 free rapid at-home COVID-19 antigen tests, okay, per month. So the first question that a lot of people ask is, are these, do I have to choose one or the other program? The answer is no. You can order your 4 test kits for your household for free. You can do that today. You can also take your insurance card If you have Medicaid, CHIP, or private health insurance coverage, and you can go to a pharmacy, a Walmart, a grocery store, wherever they sell the rapid test kits, you can show your card and you are able to access up to 8 free tests per month with no copay. Interestingly enough, and someone just put it in the chat, they did not make this provision for Medicare recipients. I can't tell you why, but for Medicare recipients, they are not able to take their card and go to a pharmacy or a grocery store and access up to 8 free tests. Again, I have no idea what the rationale is. I do understand that Medicare recipients are able to get free rapid tests or PCR tests if they go to a medical provider, and that is without copay. But I'm not sure what the thinking was with CMS. I hope that clarifies it for you, Lynn. Morali?
Hi, thank you so much for this information. I'm with Broward Community and Family Health Centers in Florida, and we have been canvassing our neighborhoods and scheduling patients to try and come to our clinics to get tested, but sometimes they don't come. So we're trying to find a way that we could go to their households with the test and actually perform it in-house.
Yeah.
And we've ran out of supplies here at the clinic, using it in the community several times. So I will definitely advocate for a bulk order eventually, hopefully if we get it. However, if we go door to door as early as tomorrow and we order these tests per household, is it okay? And it probably is, but I just wanted to ask, is it okay if we continue to follow up and track these community members as part of our database? Because we have to show if we are being a facilitator of getting tests to person's home, we would have to include it in our tracking system, and probably just follow up with them to see what their results are and if they need any other assistance. Is that okay?
Yeah, so a couple of things. You know what your community needs, right? So you know that going door to door might be the best strategy for a certain individuals. And this is why we need to advocate for bulk tests, because Morali, if you had 5,000 tests right now, you could begin getting them into people's homes. You could help people understand how to use the test,
Right.
when to use the test, right? There's additional literacy that is involved. And that's one of the reasons that we developed our website, to sort of help people understand that. Let me say just a couple of things. When you filled out the assessment form, that is to help us understand what your capacity is. So whatever that is, that's what we're going to advocate for. We're hoping that the next round of 500 million tests, and we've already heard from President Biden just a few days ago that they were thinking about ordering another 500 million tests. And they also said they were thinking about distributing high quality masks, because we understand that with the Omicron variant, you can literally walk into an elevator where someone has sneezed and there is a risk of you becoming infected. This is a highly infectious, if not more critical virus in terms of a hospital
Transmissibility. And so, yeah.
So it's important that we have access to all these tools and resources. One thing I just want to clarify, we are not asking you to track anyone on our behalf. There's no data
Okay.
we are asking for from any of you. We're offering all of this for free. You don't have to check in with us. We hope that it's relevant for you. However, one thing I do want to say that is important, as you help people to order these tests online, okay, when you're inputting first name, last name, household address, or you can put in PO box, apartment number, whatever the household address is, there are a lot of people who do not have email addresses, okay? If you are assisting someone and you want to help them track their package, because people are going to be asking you, right?
Yes.
You, they know you, they don't know me. You can input a work email address.
Okay.
So the White House system does allow for repeat email addresses. So I can use my info@nachw.org for 100 people if I want, because I'm helping them. It does not allow for a repeat household address. And it does not allow for a work address. So some people are saying, well, I have clients that I work with, but they're transient. They don't have a permanent address, okay? They're homeless, so they're sleeping on someone's couch, they're with a family member. You will only be able to order by household address. And
Yes.
they're able to tell whether it's a business or whether it's a home address. Okay, I just wanna clarify that.
I appreciate that point. That's very useful.
We go, and then from there, the lady personally escorted me upstairs.
Oh, okay. Last thing I just want to say, because Morley also brought it up, and it may be relevant to your organizations. And Aurora, if you could bring back up the 4 ways that people can access tests. So we've talked about a couple already. What's important also is that some of your organizations may be eligible for another program, okay? And hopefully everyone can see this fine on the page. This program is listed under number 4. Thank you, Aurora. And it is a program operated by the Centers for Disease Control. I just found out about it a little more than a week ago. Okay, so it may be new to you as well. It's called the Operation Expanded Testing. This program allows certain types of organizations. If you are a child care center, a K through 12 school, a historically Black college or university, a congregate setting, such as a homeless shelter, a domestic violence or an abuse shelter, okay, a correctional facility, and there are other qualified sites, you can enroll your facility to become a site for expanded testing, okay? And so again, I invite you to look at that opportunity as well. You can download this one pager. We can also put this link directly in the chat. And if this is open to you, to your organization, it may be of benefit. Rosalba, you have a question?
Yes, I have a question. So let's say that the test is only if you feel that you were exposed to COVID, right? It's not like you get all the families run and get it, no? But the thing is that you could get it right now in the case that you might need it. So it's important to know the shelf life. But the other question that I have is that Omicron is very contagious, no? So we went on vacation and we just got back before all this happened, of all places, to Florida. And my son got tested and he's negative. So we were in the same plane, we were in the same room. So we did it because we don't want to burden the resources. We just said, we picked one and he was a 1. So the likelihood that the rest of the family, we don't have symptoms, is the likelihood is very high that we don't have COVID. Yes. So I'm thinking, in order to, like, let's say somebody does get exposed and they have the 4 kids, that maybe they should just, if they were exposed, just use 1, or the one that was more exposed. Because I mean, 500,000 sounds, 500 million is a lot, but the population of the United States is 56 million people. So I think that that more information should be given on how to use it, because you could exhaust those numbers very easily. And
Yes.
And that's one of the things that kind of scares me, like only the people that have money, that have internet will be able to access it.
Yeah.
And then people that don't have internet, that are low income, that don't have proper ¿cómo se dice? Broadband won't have access. So to me, this is also, it could be like for inequity, again, we only serve the people, the haves and not the have-nots.
Yeah, well, so number one, these test kits were purchased with tax dollars, okay? So every household, 125 million households, right, should be able to receive a package with 4 free tests, okay? Whether you can use these tests today or next week or next month, these are our tax dollars. And it's very important that people who want to take in this initiative, even though it's very limited, should be able to take part. Now, everyone has a different level of risk. You're absolutely right. My husband is a firefighter, and so his risk is different than someone who is working at home every day and lives alone, okay? We have to educate our communities, and we have not done, we as a society have not done a good job of providing public health information, clinical information about the pandemic so that people can understand their level of risk, what they should do if they are exposed, what it means to have been exposed, what it means to be symptomatic or asymptomatic. And so we have much work to do. And of course we know we have a lot of work to do around all the other conversations around COVID, masking and hand washing and testing and social distancing and vaccinating and boosting and all of these types of things. And it's very difficult for people who do not spend every day reading the news and watching the CDC updates to grasp a hold of this and to make the decisions that they need. And that's why you are so important. We have made available on our website the symptom checker. We want to educate people about what it means to be symptomatic and asymptomatic. As I mentioned, as soon as we get information about what kind of tests are being mailed, we will upload that information into our FAQs. And if you sign up as a partner, we will push that information out to you. We know that everyone cannot read the instructions. So we want to make sure that there are videos available, that there are infographics available to help different people access this information. Christiane and then Melissa.
Hi, everybody. Thank you,
Hi.
Denise. And yeah, in regards to just a quick comment about Rosalba's comment, previous question and comment. We are an organization that serves farm workers, and I definitely would like to be included in the bulk recipient, because as you know, as Rosalba was talking about have-nots, is a great example of people that not always have a mailbox, for example, to receive those tests. So we would like very much to be involved in helping them having access to the tests. Of course, the internet is another concern. I don't know if the site's available in other languages or only in English. That will be another concern. But my question, I think you don't have an answer for this question, which was, and I have also a suggestion that I don't like to forget about it, although I don't know if you have this level of access to help at all with that. But the question first. So the question is, in regards to you said that you don't know what type of tests. So I wonder if those tests are the ones that can be certified, the results, or it's just something that, is there any type of official result that a person can use after testing?
Yeah, that's a very good question. I'm sorry, did I cut you off?
No. And then
Okay.
I don't want to forget about the suggestion, but that's my question.
Oh, okay, perfect. So first of all, appreciate your comments, absolutely. And yes, we look forward to advocating for you, because if you are working with farm workers, we know that they may be living in congregate settings. They may have multiple generations in the family. they may have lower access to other health services and may not have access to masking or social distancing. So we are happy to help advocate with you. So thank you very much for that. Yes, I think it is important to note that these are not PCR tests. The PCR test is what you have been hearing about that, for instance, is accepted if you are traveling internationally. Okay, you can only, get on an international flight to some places unless you have a PCR test. If, for instance, your employer, let's say you have some sort of exposure and your employer says, okay, well, you need to get a COVID test, that individual should check with their employer to see if a rapid at-home test would be acceptable, because in many instances, it is a screening tool, okay? It's a screening tool. It's very much like if you called a nurse hotline and you said, well, I have a low-grade fever, I've been coughing, I feel sort of dizzy, my stomach is sort of hurting. The person is not going to diagnose you there. They may say, watch your fever. If this happens, you should see a doctor. So the rapid at-home test is a screening tool. Some employers may accept it, but that individual is going to have to sort of navigate that with their employer. Last note on the test, and then we'll go to Melissa. These are not the kind of tests that you have to mail out for results. So I also share that. I don't think we covered it here, but that was asked in a previous session. Melissa, how are you?
Denise, could I just make my comment before I go?
Yes, Christiane. Yes,
and
please.
actually, thank you for your answer. I imagine that then people can keep or take a picture of the result that they get it and share with the employer, I guess, in a case that's something that is requested. My recommendation, again, based on what Rosalba said, is I wonder if two things. The campaign should be very directed at teaching people what to do after receiving the result, because my feeling is that a lot of people would not have any clue. What if I have positive? What should I do? They might not know. So that's important. And the other recommendation would be, I wonder if, since touching again what Rosalba said about have-nots, inequality in this country being so huge at this point, I wonder if the people that have health insurance could be perhaps oriented to first use their health insurance resources to obtain the test and let more people have prompt or faster access to these that are available for free and for everyone, for the folks who do not have health insurance or any other venue to access the test. So thank you so much.
You're welcome, Christiane. You're really talking about strategy, and you're right. These strategies should be well integrated so that we get all of the tests, because we have such limited supply to everyone who needs them. Melissa, thank you for your patience.
Thank you. Talking about messaging, I'm looking at the website. When you log in the page for order the test, and then I scroll down to download this presentation and one pager. When I click about in the Spanish version, I don't see the second flyer about how to help the community. I work with the Latinx community in Hendersonville, North Carolina, and I feel like I'm gonna have to be making a lot of phone calls and to help them. There's not internet access. Some people don't know how to read, talking about the same inequalities that we're talking about. But I feel like we need to create some kind of communication kit that can help the community understand what they need to do. And like right here, I don't see the document of how to educate your community about this opportunity in Spanish. And I don't know if that was a mistake or you haven't posted it yet. So because I want to post it today to start making phone calls, today if I can, to help the families.
Yeah, and it may just be an issue that we haven't received the translation back yet. we launched this on the 14th, and I think we posted the English version on the 16th, but let me check with Aurora. Do we have the
Okay.
translation and we just need to get that?
In English, if you go down, like after the presentation, there's download this one pager, there's download
Yes.
this other one pager, how to educate your community. But when I go to the Spanish version, I don't see it in Spanish. So I was wondering. And the other question I have, and you might mention it before, what happens with families? Like a lot of the Hispanic families have four people.
Yeah.
How do we access more than like 4 tests for families that have 6 people, for instance?
Yeah.
And that's it. Thank you for all the information.
Oh, no problem. Aurora, you answer the first question. I can take the second.
Yes, Melissa, thank you for letting us know. We do have that flyer. I think it just hasn't been put up on the website. If you want, you can private message me and I can send that right out to you, but we'll get that up on the website as soon as we can. But thank you for letting us know.
Okay, so we have that available and it is translated, yes? Okay, fantastic. So Melissa, that was just our oversight. And thank you for pointing that out because we do have it available. We are translating all of our materials. Our website is also available in simplified Chinese, and we've had many people order. And we are also translating into Korean, Arabic, Vietnamese, and Haitian Creole. I don't know if there are other languages, but those are the ones that we're looking to as well. Let's see. Oh, the second question, yes, is very obvious. If you have a family with more than 4 people, you're going to be very frustrated by this initiative because only 4 test kits are going to come to your home. Okay. That's one of the reasons why we were sharing the other opportunities for people to gain access to testing. When you go to place your order, you will not see a place where you can enter the number 7 for if you have 7 family members. There's no drop down for you to be able to request a particular number. So this is a very limited initiative. Melissa, that doesn't solve the problem, but you are absolutely right. That is one of the problems of this, the way that this initiative has been designed. Okay, I know Brooke, you've had your hand up for a while.
Thank you so much for answering all these questions. You actually answered a lot of mine before I needed to ask. You may not know the answer, but I thought I'd ask. Do you know how accurate these tests are for detecting Omicron?
I'm sorry, can you say that? I could not really hear you that well.
I apologize. I am driving. Do you know how accurate? Do you know how accurate they are for testing Omicron?
Yeah, so Omicron is just a variant of SARS-CoV-2. So these rapid antigen tests are going to be able to screen for all the variants, okay? The challenge is, and someone asked this yesterday, the challenge is the risk of a false negative or a false positive. So some of you have seen in the news that some of the, no test is 100% accurate. Some of you may know it's the same with a pregnancy test. It may be 98% accurate, but it may not be 100% accurate. So when you take a home test like this, there is a risk, and this is why we want to know which companies are going to be used so that we can share with you the data on what that company has understood to be their relative risk for a false negative or a false positive. We don't have that information right now, but as soon as we do, we will make it available. I think it's a great question. Again, people need to use this as a screening tool, right? This is not to diagnose yourself. This is a screening tool that people should take in consideration with other factors. If you know someone else that you have been in close contact with, it has tested positive, and you have a relative risk, if you have symptoms and you use the symptom checker that's on our website, you can pull together enough information to figure out whether or not you need to seek medical care, a PCR lab test, or something that helps you to confirm. I do hope that's helpful. What about people who live in the same house but are not family? Yeah, so that's okay because they're not asking for any information about individuals who live in the house. So you don't have to declare the name of each person living in the house. You simply have to put the first, last name, the mailing address, and the zip code. And you will only get 4 tests. Whether you have 10 people or 1 person, that household will receive 4 tests. So I hope that is clear. Audrey, you have a question?
Sorry, I was on mute. I wanted to share, I have been working at my children's school. We have a group of parents, volunteers who have been doing antigen testing for about 3 months now. So I want to share, you know, obviously can't quote me exactly on this, but I want to share at least a little bit of what we have experienced. And the reason why I'm here is because the testing that was provided to us can only be done on site. They can't provide the at home, which we think it's a bit crucial to have available, like we all are understanding.
Yeah.
So what I want to share is that the antigen test is actually really accurate, but we learned that it's a snapshot of that moment when you're taking the test. So let's say that you went to visit your mom and your mom happens to find out, you know, that she is positive and you were with her yesterday. I would say, because we are limited on the number of tests that we're receiving, right, what we have found is that if you wait at least until you have some symptoms or wait a day or 2, when you're are, I guess, more likely to have high on the virus on your body, it's going to be a bit more accurate. And you will see on the lines that you see on the antigen test, if it's really bright, that means that you are like at the highest point of being contagious. We see a lot of people that are asymptomatic. We've seen families that one person will test today positive and then the rest will be negative. 2-3 days later, then a second person of the family may become positive. So my suggestion would be to, if you have contacted somebody today, unless you have symptoms, then wait maybe a day or 2 so that if you actually have the virus, it is at its strongest and it is easier to detect it. That way you're not going through all 4 tests at one time. Does that make sense?
Yes, yes, it does. Thank you for that information. And we have some links to some of those recommendations on our webpage. So we are over time. I want to acknowledge that people are in the middle of their workday or at the beginning of their workday, depending on where you live. And we want to thank you very much for spending time with us. Some of you have placed orders while you've been on the site. Some of you are just finding out about this opportunity. As I mentioned, there are 2 one-pagers that are available. One of those one-pagers talks about all 4 opportunities for you to help individuals access free rapid tests. The other is a flyer, and we just realized, and Melissa helped notify us that the Spanish translation was not up on the website, but we do have that in Spanish. You can download that and print that in black and white or in color if you want to share with community members, you know, co-workers more about what you are doing. We continue to diversify the languages. I saw some more requests there. And the slides that we shared and all of our FAQs about shipping, about PO boxes, about addresses, about the number of test kits, what to do after you test positive, how you can track your package, and many more questions are available on our webpage. We sincerely hope that this has been beneficial to you. We know that without you, communities would not be thriving, surviving, and we also know that you've been in this fight for a few years now, and so have we. And so we send love to each and every one of you. I pray that all is well with you and your family and your community. Thank you again for spending time with us and for partnering with us today. And look for those emails because we will continue to push out information to you now that you've been so kind to share your information with us. So stay safe, everyone. Thank you. Thank you very much. Thank you.
Thank you. Thank you.
Thank
God
you.
bless everybody.
Thank
Well
you.
Thank you
done.
very much.
Thank you, Denise.
Thank you.
This is
Thank
amazing.
you.
Thank
You're
you.
very helpful.
Thank
Very
you.
helpful.
Wonderful. Thank you.
Thank
Happy
you.
New Year to everybody.
Thank you.
Thank you very
Thank
much.
you so much.
Wonderful.
Thank you so
You're
much.
welcome.
Thank you.
Mahalo nui.
Mahalo nui. Thank you.
Bye, thank you.
Okay,
you.
thank you.
Hey, hello,
Is there-
Denise. Can I ask a quick question? Did she go? Hello? I think they're signed off.
I think Denise had to hop, but I'm happy to help if I can.
Oh, okay. Hi, Aurora. Thank you so much for answering my question. I know you had stated since it was recorded, you would be able to send it out. So because I registered for it, is that the email you'll be able to send it to?
Yes, definitely. So everyone who's registered for these calls, we will be sending out an email with all of these details. So if you didn't get anything in the chat, don't worry, we're going to send you another email. We're going to put this recording up because I know we have a lot of great information and we'll send that out. So if you want to share it with other folks, we'll absolutely make that available.
Okay, awesome. Now, will
Okay.
there be another information session or this was just the only one? This is the last one? Because I
This is
kind of
the-
got the tail end of it.
Yes, this is the last one, but if folks are interested and they feel like they need more updates, please let us know. I will put our info email in the chat. It's info@nachw.org.
Okay.
You know, we put a poll up because if folks need this kind of information and want us to be hosting these calls, you know, that's something that we're open to doing, absolutely. So we really appreciate your feedback and joining us today.
All right.
Aurora,
Thank you so much,
can I
Ms.
ask a quick
Aurora.
question? So I was driving